It's my pleasure to introduce our second speaker, Ben Harrison, who is the director of the Work Foundation at Lancaster University. That is a think tank that engages directly with workers, employers, policymakers, and leading academics to deliver rigorous applied research to improve the working lives of people across the UK. Prior to this, Ben's 20 plus years of experience spans leadership roles across the public, private and third sectors, including being the Director of Engagement and Insight at the National Lottery Community Fund, being the Director of Communications and Development at the Centre for Cities, and establishing and leading the not-for-profit Future of London Policy Network. So it's with real pleasure. I hand the floor over to you, Ben, if you'd like to take over and share the screen, and I'll raise my hand and turn my camera on when you're about 20 minutes.
Excellent. Thank you so much, Daniel, and thank you all for having me along to talk with you today. I'm going to try and share my screen, hopefully as quickly as I can, but maybe while that is happening, I can say a little bit about the Work Foundation and what I'm going to talk to you about today. So, as Daniel mentioned, we're a policy unit at Lancaster University. We've got a long and storied history stretching back well over 100 years now. And really our primary focus over the course of the last sort of 3 to 5 years has been to try and understand more about the relationships between work, the quality of work, the security of work, and the outcomes that individuals face. A big part of that, particularly in the post-pandemic period, has been around health and health outcomes. One of the really sort of significant and animating factors or sort of features of this parliament has been this rise in health-related economic inactivity, and that is going to be a big part of the context of what I'm going to talk about today. Can I just check if you're able to see my screen or not?
Yes.
You are. Are you able to see the slide deck?
Now we are. Yes, thank you.
Now you are. Excellent. Okay, let me pop that up into slideshow so you can see it fully. Yes, so this rise in economic inactivity, particularly due to ill health, as a sort of big animating factor for government, for a host of reasons, really. There's a sort of significant implication around the economy, around the sort of quality of life for individuals across the country, for the public finances due to the implications on the welfare bill. And although the sort of the rise in economic inactivity due to ill health has slowed somewhat and is in fact sort of plateaued over recent months, it still stands at a near record 2.78 million people who are out of work, not looking for work, and give the reason for that as being ill health. We also know, due to the Charlie Mayfield inquiry into keeping Britain working, that we have 4.1 million people in work at the moment with a work-limiting health condition. So this isn't just a factor that's impacting those out of work. We have a serious issue with people in work dealing with health issues, and that some of the biggest increases that we've observed over recent years have been amongst younger people, and in particular there is a mental health factor to all of this. So there have been increases of over 500,000 younger people whose main health condition that they cite is mental health related. And inevitably these things are linked. So across all age groups there's a significantly higher risk of becoming economically inactive due to ill health. If you have a mental health condition, it increases the chance by around between 3 and 5 times. So with that sort of backdrop in mind, at the Work Foundation we've been doing quite a lot of research and engagement work to try and understand the factors that are really at play underpinning why we've seen the kind of rise in different health conditions that we have, who's most at risk, and what kinds of government and employer action could be taken to try and support those with a health condition to return to the labour market, and support those who fall ill while at work to remain in the labour market. And so we conducted a major survey this summer. I'll talk you through some of the results as we go here, of UK workers to try and get their perceptions on their own health and that of the labour market. What we found was a sort of stark level of workers who reported themselves being in ill health. 1 in 5 saying that they are in poor health. 1 in 17 reported that it was likely that they'd need to leave their job in the next 12 months due to health reasons. That may sound like a small number at first, but actually it represents more than 1 million workers. And I think crucially, mental health here is playing a big part. 15% stating that they're in poor mental health, 1 in 10 reporting poor physical health. And these things, as I mentioned earlier, are connected. So digging a little bit deeper into the findings themselves, I think one of the sort of key messages that came from the work is, the nature of work itself is shaping the choices and decisions that workers make. We've saw from across all age groups, workers taking choices that may be detrimental to their health, and I'll get into a little bit more detail as to the factors that might make that more or less likely. But 2/3 of individuals reporting that at some stage they'd gone to work when sick and when they felt they should have taken time off. But again, given the theme of today is really around mental health, worth noting that around 1/5 of workers reported that they don't feel comfortable talking to their employer about mental health issues, which of course significant factor if any of that is going to be resolved through changes at work. I think a few sort of particularly concerning factors coming from the survey. Number one, those who would benefit most from workplace policies that could support individuals when they've fallen ill. We found they're the least likely to be able to access them. So there's lots of research that sort of suggests that things like job autonomy, flexibility over where you work and when you work, being able to have more autonomy over your workload, and for that workload to be appropriate and manageable, a sense of job security, being able to access occupational health services, all of these things, depending on your individual circumstances, can have a positive impact on you being able to manage a health condition while at work. And what we found was those workers who reported that they were in good health were much more likely to also say they had access to these things. Those who were in poor health, less likely to say that they were able to access these features at work. So it feels like there's something of a gap here where if you're already if you're in ill health, perhaps because of the kind of work that you're able to take on, which enables you to maybe balance that work with your health condition, it comes at something of a cost in terms of them being able to sort of access workplace policies or features that could help you protect your health while you work. Another significant factor around those on lower incomes. So again, it seems if you're on a lower income, then you are less likely to be able to access features or policies of work that could be protective of your health. So low income workers less likely to be able or less likely to report accessing secure employment or flexibility over working hours, working location, etc. And we know across all of these features, there are particular implications for those suffering with mental health conditions, either in the short term or over the long term. Those on low incomes are also more likely to say that their job impacts their mental health. And you see that across a range of different questions from the survey, or together with middle income workers more likely to say that their job impacts their mental health. High income workers much less likely to say that, which is interesting because you don't always see that across all similar questions. We know high income roles can come with their own stresses, so it's not to say that those in senior positions are somehow immune from mental health issues at work, but certainly from our survey it seems something connected here between income level and likelihood of reporting ill mental health at work. And they're also less likely to feel comfortable engaging with their employer on mental health issues as well. Alongside then differences when it comes to those who are reporting poor health and those who are on lower incomes, we also see a very clear pattern when it comes to health, and in particular mental health, with younger workers. And I think this is a particularly worrying set of findings for government, and indeed for all of us. So young workers most likely to be concerned that their health will deteriorate in the next 12 months of any age group, and more likely to rate their mental health as poor by age group as well. And we're seeing this through wider labour market data as well. So we've got significant levels of young people not in education, employment or training at the moment, and increasingly employers reflecting that they're finding it difficult to recruit and retain young people in the workforce. In terms of then what one might think about doing to address the landscape as we see it, we've done separate research looking at how we can think about jobs in a different way to try and tackle some of the economic inactivity that we see, and in some respects reflecting on some of the factors that we've already heard about in the session so far. What we find is that the first year after the onset of ill health is key. So both prevention work, absolutely important, but early intervention work, as and when it's needed, absolutely crucial. We see that you are much more likely to leave your job if you if that early intervention is not received. So if your health condition goes untreated or unaddressed over that period, then you're more likely to leave the workforce. Likewise, workers with multiple conditions, more than 5 times likely to leave the workforce. And again, that can be a mix of physical and mental health conditions. And a lack of flexibility or control over your workload increases exit likelihood by 4 times. So those are things that I think are sort of telling us about where the direction of both government policy and employer policy needs to go. However, employers themselves respond that they are struggling to deal with some of these factors and are unsure really about how they themselves can respond. Particular issue for SMEs, smaller organizations, those that perhaps don't have the capacity and expertise to be addressing these issues always in-house. And so while over half of respondents to our survey thought that employers bared responsibility for the decline in health that they'd experienced, we know that less than half of employers offer flexible working arrangements, and just around a third, a little bit higher, of employers provide occupational health services. And that's unlike the situation in other countries. And it's not just the provision of occupational health, but it's also the quality of occupational health that is often on offer. That is a challenge. So in terms of then thinking about broader next steps that we feel we need to see, much of which is in play in terms of a kind of government reform agenda around this area. There's clearly something that's important around flexibility at work, particularly for those most at risk of poor mental health. And that flexibility can be around working patterns or working location. It can be around even relatively small interventions in terms of being able to take time out of work to go and access medical appointments, for example. But clearly being able to access different kinds of flexible working at different times, if you have a long-term health condition or a long-term mental health condition, can be really important in terms of one feeling able to remain in the workforce. There's something around strengthening employment protections and workplace health policies, particularly for those on low incomes. The government is introducing its employment rights bill that will in part address rights to flexible working, but it also aims to drive up security for workers more broadly. And there is the Charlie Mayfield review in terms of thinking about new policies and interventions, drawing on international expertise that is and international examples and expertise, which is due to report in the autumn as well to government. That should hopefully be able to make an impact here, but it will leave quite a lot of scope really for employers to think about how they're going to respond to those agendas and how they can make sure that they have a positive impact. I'm sure every colleague on the call is aware of the issue around waiting lists for specialist mental health support. I don't pretend that there will be easy answers to sort of reducing those waiting lists, but in the process of doing so, there's clearly something around provision for young people in particular that needs to be thought of here, because that's where we're seeing, it seems, the biggest rise, and from a labour market perspective, some of the biggest concerns around the pipeline of workers more broadly. And then I think there's something which comes through in a lot of our research and other organisations' research in this space, is that line managers themselves need more support, training, because they're often in the front line of dealing with issues within organisations and having to pivot between what they're seeing within their teams and then potentially workplace policies which are either evolving or are not keeping up with the kinds of changes that are being seen within organisations. And we also find that line managers themselves, due to that pressure, can also succumb to some of the mental health challenges that we're describing. So we're not very good at that in the UK. We have a sort of missing bit of our workplace culture around supporting managers. But no doubt part of the sort of the solution to some of these issues that we're seeing is trying to change the dial on that and making sure that our line managers are equipped or better equipped to support colleagues around these issues. I will stop sharing my screen there, but very happy to take questions, discuss more broadly around some of these issues that we're seeing as a whole, and look forward to the conversation.
Ben, thank you so much. That was a really stimulating, interesting talk. Thank you for taking the time to prepare and come along today. So we have 8 minutes for questions. If you'd like to ask a question, could you put your hand up? Mandy, straight in there.
I'm sorry, I'm probably not supposed to ask the questions, but just a quick question, Ben, that struck me on that survey data. Did you, or is there a possibility of doing an analysis by region to look at the you know, what the picture is in the north versus other parts of the country?
Yeah, absolutely. So we're in the process of working through some of that. We've done a quick cut for the northwest, perhaps unsurprisingly given our sort of home in Lancaster. And I mean, what you see there is not sort of radically different to the national picture, but obviously given the economic geography of the region, and you know, the fact that it sort of, yes, there are sort of metropolitan areas where there are larger organizations, there is a kind of diversity of different jobs and options for people should they find themselves not able to continue in their current role due to a health condition. In other parts of the more rural northwest, that's much more challenging, and I think you see some of that kind of coming through the findings. And I think you're absolutely right in terms of the nature of the question. Some of these factors do need to be thought about in that context, and particularly alongside wider government interventions on the industrial strategy, and where we're trying to kind of, you know, spur growth in different parts of the country. I think the only way to effectively do that in a way that's inclusive is to really have a clear view on how health inequalities and economic activity is playing out differently across different parts of the country.
Yeah, absolutely. Yeah, be keen to pick that up with you again outside of the meeting. Thanks. Thank you.
Thank you, Mandy. James.
Yeah. Hiya, Ben. That was right interesting. Thank you. Well, both presentations interesting this morning. The or it might be afternoon. I'm in the same space as Mandy, thinking about the north-south situation, but also that all the league tables came out yesterday, and I'm wondering whether you know, the trusts that are higher up the league tables actually have respond, you know, the staff respond better to, as if their mental health is better, and whether that, you know, and then consequently then does that affect the quality of work? Because I know for myself, you know, from managing acute wards for a long time, and you know, in the past, where, you know, when things were really tricky, you're you know, the maintaining standards were complicated when you're stressed, because you're just a little bit you know, you over question yourself, don't you, and the like. So I was thinking, is there, you know, what is there a link between well-being and well functioning trusts? So I get that point about leadership for sure, you know, that you know, a lot of our leaders and trusts are, you know, at kind of management, award management level and service management level are quite inexperienced as well as, you know, as their staff, you know.
So I can't speak directly to the sort of the specific NHS setting, but I think what we have certainly observed in our wider research is that the impacts of being in poor quality or insecure employment settings can be just as bad for your health as being unemployed. And so, you know, we've had for a long time in this country, I think, a sort of sense that any job is better than no job, and that work is good for you. But actually, research over the course of the last 10 years has shown that, well, while that may be true in some settings, it's equally the case that employment, if it's poor quality or insecure or overly stressful and you don't have access to workplace policies that can counter some of that, can have just as significant implications for your health and well-being as being out of the labour market for some time.
Yeah. And of course, it's affecting students currently because they're leaving university and they're not guaranteed a job as they might have been in the past, you know. So
Yes.
there's quite a lot of unsettled third years around, isn't there?
Yeah, and it comes back to the kind of economic geography point on that front as well, in terms of what are your likely first steps into the labour market depending on where you live, and you know, the quality of employment does vary significantly across the country.
Yeah, indeed. Yeah. Okay, cheers, Ben. Thank you.
Thank you, James. Next up, we have Mark.
Oh, sorry, Mark, you're on mute.
No, very interesting. Thanks, Ben. I don't think it is true that we've been saying that any work is good for you. We've been saying that good work is good for you. Certainly, that's what I've always said in the work I've been doing over the years. And bad work can be bad for you. The issue is that what I've always said to GP colleagues, because the work we were doing was around certification and the risk of being certified off sick for a prolonged period of time. The chances of returning to work, I think, if you've been off sick for 2 years or more, is minimal throughout your lifetime because you become unemployable, and therefore you're forcing yourself and your family, unless you are independently wealthy, your lifetime of poverty and health inequalities. So that's the challenge we face. And there was a very interesting work, I think, done by the guy from Sheffield Hallam, whose name escapes me, about that 1 million plus, and that was 15 years ago, that might well be a bigger number now, who are classified as unfit for work when employment levels are low and get into work when employment levels are higher. But actually their problem is that they are unskilled, don't have a good track record of work, in and out of different types of, and they present a different challenge. It isn't really health that's at the root of their problem. It's an unstable ability to get work and stay in work, and a low qualification, which depends on who's hiring and doing what in their region. The other point and that sort of leads me to the other point, which is I don't think you can take employment in isolation, hence the north-south divide.
I'm really sorry, Mark, I can't hear what you're saying, sorry.
Sorry, can you hear me better now?
Oh, that's much better, yes.
Sorry. So what I was saying was there was I can't remember the name of the professor in Sheffield Hallam who may have retired now, did some very interesting work on the population who are drifted in and out of work but are often classed as unfit for work because they're able to find work when there's lots of employment and they can't find work when there isn't, and they're often temporarily employed in poor quality jobs. And the point I made earlier, in case you missed that, is I think I've always said, and colleagues I've known have always said, good work is good for you, bad work can be bad for you. But poverty is not good for you. And so long-term sickness absence makes re-employability very low, and therefore you're locking yourself and your family into long-term low income, because welfare is never going to be as good as minimum wage. So the other point I was going to make, linked to the people that drift in and out of work, is I don't think you can look at work in isolation aside from the living local conditions and the local culture. And any work we do that looks at work and health has to look at the lived environment and the local circumstances for populations within that employment and getting to work, access to childcare, access to other healthy opportunities, etc., etc. The state of the local NHS, and the problem is that the higher the deprivation, the higher the unemployment, the more stress and the worse the local NHS is going to be. There's a reason, if you look at that league table from yesterday, looks the way it does. You can probably pattern that against deprivation indexes.
Yeah.
Haven't done the piece of work, but I'm sure somebody will do.
I think that's spot on, Mark. Particularly the last set of reflections there, and so I was part of the Milburn Commission in South Yorkshire, looking at this issue from a kind of place-based perspective in Barnsley, and I think it is. I mean, you know, we uncovered a lot through that sort of year's worth of work, and it's interesting to see, and I think encouraging to see that government has sort of taken on some of that and is at least thinking about how bits of this can be devolved and supported to be delivered at the kind of city region level or regional level, and bringing together agendas that have too often in the past sat in separate silos, because these things are codependent on one another. So, you know, health, work, skills, local economic development, etc. It's tough to sort of operationalize, but I think absolutely vital. And of course, you're absolutely right in terms of good work and is good for you. I think sort of what I was really reflecting on is probably narrowly how the DWP and how government have tended to think about it, where they've implicitly at times and explicitly at times had a policy of, you know, ABC, any job, then a better job, and then a career. And actually, when you look at the data, what very often happens for people is they go into the any job bit, and then they bounce back out of employment again because it turns out that job wasn't of sufficient quality or right, you know, ultimately right for them. And we'll see where we get to, because obviously we've just had a reshuffle, but certainly in the early part of this government, there was a sort of commitment to decisively move away from that and think much more about tailored employment support, connecting to health professionals, etc., to make sure people have a much better chance of achieving sustained employment.
Thank you, Ben.